Hey, Samya. Hey, what a great day for you. I'm so happy, so very happy that you're being honored with this training grant in your name. And how appropriate is that? Someone who has trained so many folks for this to be done in your name. Sometimes the heroes do get recognized, so this is particularly meaningful for me. You are a hero to me because of all the work that you've done in CF, but also in global health. Thank you for that. I'm celebrating with you today. What a great day. We're rejoicing. May you enjoy it, and just know that we send our congratulations to you, so thank you.
Dear Samya, I would like to congratulate you for this success and for this award. I am fully agree with the committee that awarded this good prize to you. I feel very lucky to know you and to meet you, and also on behalf of our CF patients, we owe you so much. And also with our project, Mommy, we call you as Mommy, and also on behalf of the saved lives of cystic fibrosis patients in the Middle East and Turkey, we are thankful to you, and we wish you a good, healthy, long and fruitful life. Thank you very much for your contribution to our region and our patients.
Hello, Samya. It has been a great pleasure and opportunity for us to work with you in the last 2 years. You have been very kind and friendly and generous with your time. We are grateful for everything you have done for us, and we wish you all the happiness and the success in the world. Congratulations.
Wow, Samya, I am so proud of you. I know that your lifelong dream was to do work in Egypt, and you have come full circle in your dedication, not only to Egypt, our entire CF community is beyond measure. Thank you.
As the CF Center Coordinator at Mott Children's Hospital for the Pediatric Program, I get to see Dr. Nasr working at her best every day. She's contributed nationally in so many ways with mentoring, educating, publications, research, quality improvement. She's just really helped to change the course of CF care in the United States. And then over the last few years, she's really made a lot of headway internationally. In Turkey, she's helped to develop the center there as kind of a resource for these other centers in the area that are building themselves up as well. And then she started this work in Egypt to really help identify CF at all, where it wasn't really recognized or screened for or even diagnosed. So now that they have the ability to diagnose, Dr. Nasr is then working to build a CF center from the ground up. And that's just amazing work. She's going to change the course of so many people's lives there. And I'm really looking forward to seeing the changes that are made in the years to come because of the work that she started.
Samya, congratulations on this well-deserved honor. The children of Michigan, and especially children with CF, are lucky to have benefited from your expertise. We at the CF Foundation are grateful for your many years of dedicated service to improving care for people with CF in Michigan and throughout the world, as well as your passion for teaching future care providers. We look forward to continuing to work with you for many years to come. Congratulations.
There's some things that we share. Samya came from Egypt after medical school. I came from Turkey. I grew up in Istanbul, but came during elementary school, so that's a little bit different. We both are pulmonologists. We both have 2 sons. And what's incredible is that both of our sons, they all have the same interests. So it was really nice to, sort of connect about that. But there are also some differences, and so and it tells me that there's so much I need to learn from you, because you do so many things so well. And I know that my wife would want me to learn from you, because one thing you're incredibly organized. You make these amazing lists that I almost got a glimpse of, and your office was immaculate. Mine's a disaster. And I've never actually met anyone who doesn't procrastinate. I thought all of us did that, but I worked with Samya on this project, and she kept us in line, and I was like, no, deadlines, they don't really mean anything. It's a suggestion, but not for you. You're always, for our CF conference, we actually have our talks that are due next Friday. Samya already recorded hers. I haven't started working on mine yet. So it's really amazing. And she's really a professional multitasker. I mean, I don't know how she keeps all these balls in the air, but she has a finger on the pulse of everything. She's part of every committee. She also, not just the CF Foundation, but the American Thoracic Society, and these are only the committees that I really just know about. So I know that she is really, just part of so many other things. And these are the traits that, makes her so ubiquitous and so ever present, and how so many people know her. I mean, for the videos to come from, Preston Campbell and Al Farrow, these really thoughtful, incredible human beings, and taking time to say hello, it just says so much. And I actually agree with Preston. I think that you are a hero. You're a hero to so many, your patients, your family, you at home, your community in Egypt, and to those, like you can see in Turkey, who are just grateful. I'm also close to the people that she's, helped to help other people with CF in the Middle East, and they just love Samya. I mean, this is they're genuinely, I think that, they consider you family as well. And so that's, and it's a source of pride for you, I know, and for the CF community and the global health work in Turkey and Egypt that you do. But it extends, internationally and back to your childhood home, which is, I think, just so makes it so much more meaningful. And, where your brothers and nieces, I found out, also continue to live. So when I was also thinking of what to say tonight, I thought of the words of James Baldwin, whose quotes I was recently introduced to. He's a writer and a strong voice in the civil rights movement. And he says, "Not everything that is faced can be changed, but nothing can be changed until it's faced." And Samya has been working for years to help her community in Egypt. And despite the challenges or roadblocks and everything that she faced, she's just never given up. And that is, I think, you don't give up. You just continue to work in this tireless way. And you honed your skills in Turkey a bit, and so now you're back going to Egypt on sabbatical soon, and you really made it possible, as your team member said, to make screening patients suspected with CF and the equipment they need possible. And so it's really going to be amazing. I think you're going to make some amazing changes there next summer when you're there. And Samya is facing change, not only overseas, but also here, where locally, and she's working stateside and domestically. I had an opportunity to visit the CF Center here. It's really unbelievable, and I know that there's a CF Center here in Detroit as well. And you guys are very fortunate to have such incredible centers where your children, your spouses are being cared for. And I can see both the tangible and intangible impacts of her work, and that's what I got introduced to. The tangible ones are the resources that she has advocated for her team, and I got very clear what I saw, how she advocates. I mean, she made it sound like hospital leadership was just sort of dropping these resources on her lap, but I know how challenging it is, and especially this era with such tight budgets, to be able to get resources from a hospital to get the things you need. So I know that her work is that she's tirelessly trying to get those resources for everybody, and for the patients. I mean, really. And so I'm going to be going back and really sharing with our group, being like, this is what Michigan's doing. So you got to do this as well, because you're our competition. But the intangible is an incredible and dedicated team of people who work together with you and benefit from your leadership and your model of care. You are dedicated to people with CF and their families, and as you can see here, and with Emily and Molly, just how just what a great physician you were to them, but also mentor. And you contribute a great deal of time in a variety of research, clinical work, and for further knowledge and ultimately CF care. You foster a spirit of continuous learning with your teams and involvement in QI collaboratives. That's what you're doing in Egypt and Turkey. And you just have a warm heart, and you make every effort to improve the lives of the people you serve. I mean, that's really, just how I really see you, and I know everyone else here as well. And so all of this is in addition to what is perhaps the greatest impact. You're raising two incredibly accomplished boys. To find out the things that they're doing, I mean, I'm not going to share it because I don't know if you want to share, but they're doing some amazing things. So you and Saeed, who I got a chance to meet today, and everyone loves your husband. So clearly, you guys just make an incredible couple. Yes, Saeed. And these are exactly the reasons why we're honoring you here tonight, why Laura is honoring you and the CF communities are honoring you. Because of your desire to teach and improve the knowledge and educational opportunities of all those around you to improve their lives of not just your patients but providers and the care team. You're dedicated to building a strong care team and mentoring all of them to excel in their discipline. So you really are working on with not just the physicians, but the nurses, the dietitians, the respiratory therapists, physical therapists, and you're just a great representative for pediatric pulmonary, for CF Foundation, for the Muslim community. Here, your team in Ann Arbor, you're just a great representative of a human being, and it is the reason why so many people who respect you and want to honor you here. So, just like Bülent said and the Turkish team said, you are a legend. And over there, they reverently refer to you as Fikir Baba. And it's actually more appropriately Fikir Anne, because Baba is the dad and Anne is the mom. So, and that really is the idea person. You're like really the mother of ideas for them and globally to other people. So thank you for bestowing on me the privilege of honoring you, Laura, but to you, Samya, our own mother of ideas and knowledge with this, and it's just, just makes me so happy. Laura's going to come up and present the award that she put together for you, but it's just a privilege to be able to stand here and congratulate you. Thank you.
So we started a fellowship in honor of Dr. Nasr at the University of Michigan. This first year is going to be 10,000, and our goal is to just make it like to 1 million someday, but that's our start. So the sponsors are Dr. Susan Millard, Dr. Euler, Biophysics and Biophysics International Corporation and Spark Health so far, and we're still getting donations and other people are going to be donating, so I just wanted to thank them publicly. And this will give, she's not retiring anytime soon, but this will allow her to train other doctors to keep going in her footsteps, so we're really excited about that. Dr. Nasr, can you come on up? We can even take the plastic off. But in her honor, we just wanted to give her this Lifetime Achievement Award for everything that she's done and continues.
Thank you very much. That's really totally unexpected to get all these people from the CF Foundation to get Ahmad here to do this. That was really interesting and very, very good. And then Dawn didn't tell me she's doing that, and Kathy didn't. So my team is sneaky.
Dr. Nasr asked me to include Kathy on some emails, and I was like, I'm in. I got my contact.
So thank you very much. That's actually a lot more, it's such an honor, and you guys inflated my ego quite a bit today. so my poor husband has to deal with me. Thank you very much. Yeah, the work in Turkey and Egypt is very close to my heart, and I'm extremely, extremely happy to be able to do that and to give back to them. So thank you. But of course, my babies here, all my patients are my babies. So they're the closest to my heart here. So thank you very much.
Like the 1950s there for cystic fibrosis. And she's been trying since 1997 to get people tested for CF there, and the doctor said it doesn't exist here. And her persistence, I think it was 2007, she convinced them, people in Egypt have cystic fibrosis, and once they said, okay, you can test them, She diagnosed, what, 1,000 people off the bat? And she believes now that she has the correct equipment in Egypt that she'll donate about 10,000 more quickly in the next few years. So it's, everybody in the world should have the same, access to drugs. So it's very sad. I've seen pictures of the children she helps. They die by the time they're 12. The life expectancy here, if you're born today, is 47. It's 12 in Egypt. So
That's exact. And actually the foundation and the Middle East CF Association was very generous to give the donation of equipment to Egypt.
yeah,
That was
so
after years
she
of
has
work.
changed the world. She has changed.
It's not complicated. We all got our worries and fears.